Hey guys, so in today's video I wanted to talk about the differences between a medical assistant, which is what I am, and a QMA or a med aid. Indiana in this state calls it a QMA, which is a qualified medication aid, which you have to be a CNA in order to become a QMA, and you have to have worked 1,000 hours plus take a class and pass a test in order to be a QMA in the state of Indiana. Other states call them med aids, or some even call them medication techs. But that's neither here nor there. I just want to explain the differences because someone said that at their facility they actually call them medication assistants, and so sometimes it gets a little bit confusing when you have a lot of similar terms to describe different jobs. So obviously a medical assistant is someone that works mostly in outpatient settings under direct provider supervision, usually in like an advanced provider such as a physician or a PA or a nurse practitioner. And a medical assistant can be delegated to do clinical or administrative tasks. So that's what a medical assistant would do. Now, with a medication aid, a QMA, a medication assistant, or a medication technician, they usually work in inpatient settings, usually under the supervision of an RN, and their primary task is to pass medications, again, under the supervision of that nurse. So with the medication aids, QMAs, whatever, whichever one you want to use or whichever one applies to your state, they usually are found in assisted living facilities or long-term care facilities. At least in my experience, what I have found is that mostly they work in long-term care facilities or assisted living facilities where maybe they don't have enough nurses to cover to pass the meds, and so they have a QMA or a medication aid go and pass out the medications to help the nurse, so then the nurse doesn't have to try to pass meds to 400 people by herself or himself. So just something that I wrote in my notes is medication aids, in like, they don't exist in some states. Other states refer to these people by something other than medication aid. Like us in Indiana, we call them QMAs. In some states, an individual must first meet the requirements and register with the state as a CNA in order to be eligible to receive additional training to become a medication aid. So that's what I was telling you about, like in Indiana. This is going to be different from state to state, but in Indiana, you have to have worked a minimum of 1,000 hours within a certain span of time. I can't remember exactly what it is. It might be 2 years or 1 year. I don't remember exactly, but you have to be able to prove, like, you have to actually have proof that you have worked 1,000 hours as a CNA, and then you have to take a class, and you do clinicals, and then you do a clinical exam and a written exam in the state of Indiana before you can actually work as a QMA. Correct me if anybody from Indiana knows what the rules are when it comes to QMAs, and if I said anything that is incorrect. That's just from my knowledge, because at one point I was looking at becoming a QMA so that I could pass meds. But I will tell you, a lot of places, like at least in my state, since you do have to be a CNA also, the nursing homes or facilities, a lot of them will have you work either or. So if they need a QMA on a certain night, you'll be scheduled to work as a QMA. Or if they have enough people to pass the meds, like if they have enough nurses to work that night, then you'll be scheduled to work as a CNA that night. So it just kind of depends. It depends on, like, you know, the staff. So medical assistants don't work in a clinical capacity in inpatient settings as medical assistants per se. So if a medical assistant wanted to work as a QMA or a medication aid, they would have to meet the state requirements and register with the state as a CNA or a medication aide in order to work in a clinical capacity in the inpatient settings. I have not personally ever heard of, at least in this state, in Indiana, I have never heard of a QMA being used at the hospital. I highly doubt that that would happen because a lot of the hospitals employ the nurses that they need in order to pass the meds correctly. But like I said, inpatient settings in this case would refer to assisted livings or long-term care facilities. Some state laws refer to medication aides as certified medication aides, which the initial would be CMA, which is also certified medical assistant, which causes that phrase to be like create confusion between are you a medical assistant or are you a medication aide. So some, like with this confusion, the National Council of State Boards of Nursing refers to medication aides as MA-C and encourages the states to use this initialism. And this change was made at the request of the AAMA, which is the American Association of Medical Assistants, simply because the AAMA actually awards medical assistants the CMA title. So technically, even though I am a certified medical assistant, I cannot use, like, I can't write my name, comma, CMA. I have to use the CCMA because I did not get my certification through the AAMA, which is the only certification body that is allowed to give out that CMA title. So I hope that cleared up a little bit of your confusion. So like I said, it all depends on your state, but that is the difference. Like, medical assistants really don't work in inpatient settings like that. We work in outpatient settings mostly, if you're working as a medical assistant. Now, there are some medical assistants that work like in the hospitals, but they work as patient care techs, so they don't necessarily work under that medical assistant title. So it is all dependent, again, on where you live, where you work, your job duties, etc. So I hope that this helped clear up the confusion a little bit. If you guys have any other topics you'd like to hear more about, please let me know, and I would be glad to get something filmed for you. And with that being said, I will talk to you guys again in my next video.